Are you using the term partial hysterectomy correct? My guess is not. Let me teach you about it. Hi, I'm Dr. Alex Sherling. I'm a board-certified OBGYN, and we're going to talk about types of hysterectomies today. So we talk about types of hysterectomies. When we have a total hysterectomy, that's what we see here. We remove the uterine body as well as the cervix, and that's what makes it a total hysterectomy. It has nothing to do with the fallopian tubes or the ovaries. A partial hysterectomy is different though, and that's what's here. This is called a supracervical hysterectomy, and in this case, we leave the cervix behind. This can be done for either patient preference or if it's unsafe to remove the cervix based on the patient's anatomy. In the case of a supracervical hysterectomy, you still have your cervix, so make sure you continue to go to your gynecologist and get your pap smears. If you have a total hysterectomy or a supracervical hysterectomy, you can have it with or without your tubes and ovaries being removed. That's what's called a bilateral Salpingectomy. And in this case, we're talking about bilateral, meaning both sides, tubes and ovaries. If you remove your ovaries, this is called an Oophorectomy. Sometimes we can take out one, which is a unilateral Oophorectomy, meaning the right or the left, and sometimes we need both, bilateral Oophorectomy. The reason that we leave your ovaries behind is because we want to keep those hormones. This prevents you from going into menopause. We can remove your uterus if you have uterine problems without putting you directly into menopause. Now, removal of your uterus will put you at a little bit of an increased risk for earlier menopause because of the contralateral blood flow to the ovaries, but just having a hysterectomy does not mean that you're in surgical menopause. So when we remove the tubes, we do this bilaterally. This typically decreases the risk of ovarian and fallopian tube cancers. It's also what we do during a tubal ligation procedure. So if you've had a hysterectomy premenopausal and you still have your ovaries in, most likely you had a total hysterectomy with bilateral salpingectomy. We remove the tubes because they're not doing anything. They can increase your risk of ovarian and fallopian tube cancer. So we'll leave your ovaries in place to keep your hormones going, and we'll remove the entire uterus, cervix, and tubes. There is one more type of hysterectomy, and that's down here. That's a GYN oncologist job. And so when there's certain cancers and they need to remove not only the uterus, cervix, tubes, and ovaries, but also the surrounding tissue, like the perimetrium and the top third of the vagina, that's a radical hysterectomy, and that's totally different. So ladies, when you leave your doctor's office after a hysterectomy, it's important that you know what it's actually called and what all was removed. And your future gynecologist will appreciate that. Hope you learned something.